Welcome to the 11 o'clock hour of Chicago Now. I'm Gabriella Primus.
And I'm Natalie Bobke filling in for Tia Ewing today.
She's getting a much needed break. I'm happy to see you.
Thank you.
We have a lot to catch up on. I feel like I haven't really seen you even in the studio. Like, we usually cross paths all the time.
I know.
We've been out and about, busy.
So busy, I know.
Busy ladies.
And I was working on Sunday, which was helpful because the mayor gave a statement on President Trump potentially bringing the National Guard to Chicago. So we got to catch up with him on Sunday.
You gave me all that good sound that I used throughout the week.
Well, I mean, it was very interesting and still more to come on that. So I took yesterday off because I worked a late night on Sunday.
Well, good for you. And I do have to mention, I saw that you stocked up on Halloween decorations, Natalie Bobke, and what day is it?
Well, I don't know. What day is it, Gabby?
It's August 20-something.
You know what? I don't know what it, like, I don't know if you're like this, but some years I don't want to go all out with decorations.
Sure.
Like, I just don't have the energy. I don't want to do it. And for some reason this year, I just got this little bug and, you know, like the cool chill in the air the last couple days.
Oh yeah, I know.
And I'm like, you know what? I'm going to do it. And so I go to TJ Maxx to go take something back, and I end up with a cart full of Halloween decorations.
As it usually goes.
Yes.
Well,
and
you know
they had just put out the stuff too. So if you're a TJ Maxx, a Maxxinista, you got to hit it soon because they just put all the stuff out.
You know, that is funny because I went to Michael's just the other day and I saw all the Halloween and Christmas stuff out, and I'm like, oh, these bows are so cute, but I'm just not in that place yet where I can
Well, you've got a
anything.
wedding on your mind.
Also, I
You're
just
getting
can't
married in like 2 weeks.
purchase anything else ever again. But I'm like, oh, it'd be perfect time right now to get it because watch, 2 weeks from now, it's all going to be sold out. It's going to be trending on TikTok or something like that.
And that's the thing, you know, at stores like that where you can get a good deal, it is gone if you don't pick it up.
No kidding.
I could be a spokesperson.
Do you feel like you got some good items that you can take throughout the years, at least?
Yes, that's my goal because I like to do the outside decoration, and so I'm just going to store it for next year.
Perfect.
Yeah.
Okay. Then
it's well worth the money, Gabby.
It is. Just give me some money right now because it's all Monopoly money and it's all gone. Anyways, we have a kind of a theme show today. It's all talking about a healthier life, a healthier lifestyle. So we're going to bring in some doctors. One is going to be an integrative medicine, talking about restoring energy, clarity, and balance, how you could do that more naturally. Also talking about your standard medicine as well. And then also talking about how hidden triggers could be at the root of some chronic illnesses. So what you could do about that. And also simple lifestyle hacks from a wellness influencer is going to join us as well, and gives us some tips and tricks that we can take throughout day to day.
I love this topic.
Me too.
Like, this is so great. I see like Jennifer Aniston and Jennifer Lopez, and I'm like, how do they do it?
No kidding.
What are they on? So I'm going to ask the doctors. I'm sure they have no idea. But
I have a feeling that we're going to go home today with a couple of things that we had no idea that was in our house that might be kind of triggering us or being, that we're sensitive to, because I hear that all the time on social media. Plus, just weeding through all the advice that we're getting online. I bet that this lifestyle influencer at the end of the show is going to help us with that. But first, we have some trending topics to go through.
That's right, Gabby. Oh my goodness. Speaking of like beauty trends,
I know.
So Louis Vuitton is coming out with a makeup line. The price is disgusting, I guess, according to me, who will spend $100 at TJ Maxx. It is beautiful.
Just kidding.
But how quickly do you go through like lip gloss and lipstick? I mean, if you use it all the time.
Yeah, lip gloss pretty quickly. I would say lipstick not as quick, but maybe it's because I'm not reapplying as often as I should.
Because I'm thinking like the lip gloss, maybe a month, I guess, if you are a frequent user. This stuff is over $100 for just one tube of lip gloss.
160, and this is by Louis Vuitton. It just was released the other day, and I think we can get it now on Friday. But it's a collection called La Beauté. I don't speak French, okay, people? So
Beauté. We'll go with it.
That does sound like a. I looked it up, and it says Beauté.
Well, maybe that's part of the draw.
Maybe it is.
Is the name.
Maybe there's some kind of secret in here that we don't know about. But it was made with Pat McGrath, who's a super big makeup artist who I love to follow. So I guess it has to be good, even though it's $160.
I don't know, though. Is it? Have you tried, I've tried the Chanel nail polish. No better than other brands.
Really?
It could be Wet n Wild as far as I'm concerned.
Really?
I mean, I don't see the difference.
They've said before that some of the generic brands like Ulta brand and Sephora brand are actually made by really high-end high-end companies that are producing these for the stores.
I believe it.
I think I remember. I don't quote me on this, but like Sephora was made by Estee Lauder or something like that. So honestly, the product is just as good as the high-quality brand when it's half the price.
And the drugstore brands are so good these days.
They kind of are.
They really are. I mean, the color matching is like spot on. So it's
I could talk this all day, but I want to go through some of the other prices because the lipstick, like we said, is $160. The lip balm alone is $160 as well. Eyeshadows $250, and then there are refill options, which are $169, and then the other is $92.
I was looking at the makeup cases. There's like a brush set that's over $1,000.
What?
For a teeny tiny brush case and the brushes themselves. And then you can get a makeup carrying case, and that's over $1,000. That's crazy, but I guess it is Louis Vuitton, so you're paying for the name.
Okay, well, if you're interested at home, it says here they officially go on sale on their website in some Louis Vuitton stores on Friday.
So if you want to wear La Booty on your mouth, then make sure you check out the website and tell your friends.
All right, look, I looked at the pronunciation. That's literally what it said, Nat. So I'm hoping I'm correct. If not, I'm sorry, Louis Vuitton. I'm sorry to your viewers at home for any uncomfortableness that I have caused in your living room. Cracker Barrel. You've heard about this, right?
Yeah.
The new logo. People are upset.
Well, allegedly, I was talking to one of our directors about this. He was like, everybody says people are upset, but who are the people that are upset? Because everybody's saying that people are outraged, but I don't know that I've seen a person that's outraged. So this is the new logo. It used to be the old man and the barrel. Yeah. It was like kind of there it is, a little corner store kind of motif. And now it's just been simplified, and this comes after they renovated their dining rooms, and I think they went with like more of a neutral palette instead of the browns and the tan tones, and kind of decluttered things. And I don't know, why change a good thing?
That's true, but you're so right, Natalie. Who actually is outraged about this? Because we have been saying in a lot of scripts that, hey, people are really angry. Yeah, I don't know one person that could be angry. I also haven't ran into it online, angry people.
No. I think if you're upset about that, you need to reevaluate.
Have you stepped foot in a Cracker Barrel before?
Oh, yeah.
Oh, I have not.
Really? Ever?
No, I've never
So when we love Cracker Barrel, if there was one closer to my house in the suburbs, I would go once a month. I mean, it's like, but I'm a chain food person. Like, I like the Applebee's, I like the Chili's. But I remember growing up, whenever we'd take like a road trip down to Florida, we would stop at Cracker Barrels along the way, because you always knew you were going to get something good, and you could bide your time waiting for a table in the old country store and check out the old-fashioned candy.
Yeah, you know what? I've been to Pizza Ranches before. Is that pretty similar? A Pizza Ranch?
I've never heard of
Soup
that.
Plantation?
No.
Oh, okay. Well,
I can't say.
Anyways, I'm so angry about the Cracker Barrel.
But the food is so good. I mean, it's like down-home country cooking, you know? So you've got like the chicken and dumplings. That's what they're known for, and maybe their big breakfast menu. But it's a fantastic spot. I don't think they needed to change. Yeah, it does. We'll have to find one.
Yeah, you can educate me a little bit more.
Okay, I will.
Skydive Chicago, they broke an Illinois skydiving record. So let's talk about it. The skydivers, they met for the first time in 3 years last week to attempt a record-breaking dive. More than 450 people flew out of their planes into different formations and sizes that the world hadn't previously seen. Okay, here's some footage. I was waiting for this. So divers flew from 19,000 feet up headfirst, mimicking a Superman flight as they shot towards the ground at 180 miles per hour in a group of 200. They had just 60 seconds to form a predetermined,
That is so cool.
snowflake, unlink hands, and deploy their parachutes. Another 250 skydivers then coordinated to break the 250-way Illinois state record, one where divers flew parallel to the surface. That is terrifying.
It is, but look how beautiful that video is, and look how blue that water is. I love it. I'm wondering how they all fell at the same speed, because one would think if you're a little lighter than someone who's a little heavier, you know, you'd be falling at different rates.
I have no idea, and I don't really care to ever go skydiving either.
Yeah, it's not on my list either.
Honestly, just thinking about it, like if someone were to really sit me down and explain it like they're in that situation, I'd be terrified, even listening.
No, I couldn't even walk up to the edge of the plane. That is not for me, for sure. But congrats to those brave people who made it out alive. And this skydiving place is in Ottawa, down in LaSalle County.
I think, oh, it is, okay.
Yeah.
Because I thought it was, what is the big indoor place called?
Is it iFly?
iFly, yeah. For some reason I was thinking that and I was like, wait, that makes no sense.
No, because I don't think that many people would fit in that little tube.
No, it wouldn't, but I was like, oh, well, maybe it's people with the iFly coming together to skydive Chicago. But this is really awesome.
It is. The video totally makes that one.
Yeah. Okay, well, we have a lot more to talk about. Again, we're talking about living a healthier lifestyle. So we're going to bring in a doctor coming up to chat about some tips and tricks for you. We'll be right back. Welcome back to Chicago Now. You know, Natalie, I hear a lot of times that when it comes to healthcare, people feel like they're really just being treated for their symptoms or what's going on right then instead of, you know, the whole body approach. And so that's one of our topics today is talking about integrative medicine. So we have Dr. Amy Offutt, an integrative medicine physician who helps patients with complex conditions reclaim their health. Good morning. How are you?
Good morning. I'm very well, thank you.
Oh, we are so happy to have you. For people at home who don't know, what is integrative medicine?
That's such a good question. I try to explain that to patients, and it's a little challenging to describe, but it's really the best of conventional medicine paired with therapies that are often categorized as complementary. Really, the emphasis is on prevention, life habits, and then also just connecting all the different body systems into one rather than just focusing on symptom management, which is more what the traditional medical model is based on.
So Dr. Amy, are you looking at a patient's symptoms and saying this could be the root cause of those things and this is what you need to do differently?
Definitely. In my practice, I treat a lot of complex, chronically ill patients. And so I'm always looking for what happened to them. So the history is very important. I spend a very long time with each patient to try to sort out what happened to that patient to result in the symptoms that they've developed over time. And that's where a lot of good information is that we don't always have time to talk about in a shorter appointment. So most integrative practices do, I would call it more of a deep dive, looking at what happened to the patient, what's going on with the patient now, and how can we piece it all together to start to peel back anything that could be, optimized or treated to actually get rid of the symptom rather than just giving a medication to reduce the symptom.
Let me ask you this, what is one really common chronic illness that you're seeing, and how are you approaching that particular chronic illness?
So in the last couple of years, I've seen a huge rise in autoimmune diseases. And, it's a grouping of different diseases where the immune system basically starts to turn on the patient, and it may affect the thyroid, it might affect the digestive tract, it might affect the brain. I mean, it could honestly affect almost any part of a person's body. And I believe that almost every single autoimmune condition warrants an evaluation looking for an underlying infection or an underlying exposure. And when I go looking for those things, I often will find them. And once I treat them, oftentimes the autoimmunity can improve or be somewhat reversed. There's certain ones like type 1 diabetes is not reversible, but I have been able to reverse some autoimmune conditions in other patients like rheumatoid arthritis, like Hashimoto's thyroiditis, some especially GI-related autoimmune diseases like Crohn's or ulcerative colitis without the patient having to have surgery or take a lot of medication or, do other more drastic measures.
What typically is the most common fix for I know, it is integrative health. So like you're looking at the person as a whole, everybody's different. But if you were to pick one commonality, would it be people in general not getting enough sleep, not getting enough exercise, their diet? What is usually at the core in most cases?
I think of really 5 pillars that I try to not forget to touch on with every patient. Sleep is definitely extremely important. How people look at the world and their level of stress is extremely important in healing. Nutrition, of course, is very important, including hydration. So many of my patients don't get enough hydration, and it causes a lot of catabolism or breakdown. Things like, pain. People who don't manage their pain and sort of walk around in pain all the time are also going to eventually develop some sort of chronic health issue, because it just starts to really wear on that person's health. And so, looking at the person as a whole, I think positive outlook is one of the most underappreciated ways that people can influence their own health outcomes. And it is sad, though, because I do see a lot of patients who have gotten somewhat discouraged and downtrodden with being prescribed a lot of medications, and now they feel stuck on the medications and they still don't feel, resilient and strong and capable of doing the things they want to do. So sometimes I start with that, where we work to see what medications can we replace or reduce, and even that can help people feel better.
Do you think because you're integrative medicine, are people hesitant to come to you because you aren't, the standard, I'm going to the hospital kind of office?
I think it depends on what a person wants. A lot of people, I find more and more, want a more well-rounded approach to health and healing, and they're not as interested in just being prescribed a medication. So if someone really wants that, and I can identify that early on, I will oftentimes say, there's a doctor down the street that does exactly what you're looking for, and I think you should go and have that kind of care. Whereas, the patients that want this kind of care, they're really enjoyable to partner with. I consider them a partner in crafting a strategy for healing, and I don't think people are afraid to come unless maybe their spouse makes them come. And then sometimes I can see early on it might not be a good fit, because you do have to work and participate. If you're going to get an integrative medicine consult, there's going to be some ownership and some work to be done with regard to cleaning some things up to make, for a better outcome. I wish there was a simple pill for a symptom approach that worked, but honestly, I don't think that really is all that helpful. Definitely, I use prescription drugs. I'm an MD. I was allopathically trained, and after about 7 or 8 years of practicing that way, I just saw a lot of gaps, which is what prompted me to go back to school, and I got a master's in integrative medicine, and I'm boarded in integrative medicine so that I know more about what a patient can be offered. And I still use conventional therapies when they're appropriate. It's just not my only tool.
I've got a couple ailments that I'm going to throw your way. If you can give me kind of the most common solution to all of them. So let's say there's someone at home who is low energy and tired all the time. What would you recommend?
I would start by asking a lot of questions about sleep, about nutrition, about hydration, about exercise patterns, about stress level. And then from what I learned, I would try to help that person either overcome or adjust in each of those areas. I'll just say that a lot of my patients come to me not sleeping well. They get 4 hours or 5 hours of poor quality sleep. A lot of them are on a sleeping pill already. And so I will combine sometimes we use herbals, sometimes we use medications, sometimes we combine them, or I even use some IV therapies in my practice to help take away inflammation of the nervous system. That often will help people relax. I use things like vagus nerve stimulators. I have a lot of patients that wear those to go to sleep, and it helps them stimulate the side of their nervous system that's getting overshadowed by fight or flight. It's called your parasympathetic nervous system, and you need that to be engaged so that you can rest and digest and relax and kind of renew and restore. So when someone is in a lot of pain or under a lot of stress, that side of the nervous system often gets overshadowed. So there are tools, even some of them are not medications, that we can give. Very simple things. Many patients take magnesium, some take theanine, some have a little bedtime ritual that helps them wind down and engage better in sleep initiation. So you're exactly right. It is very individualized to each patient.
So I was going to ask, what about weight gain? That's another one.
That's a big one.
Can you give us some quick tips on that?
So when I'm looking at a patient, I like to ask them a lot of questions again. I found that most people have multifactorial weight gain, but if someone gains weight all over, that's often an insulin resistance issue, and they need support to overcome their insulin resistance, starting with learning what the person eats. Adjusting what someone eats would be the most basic foundational way of lowering insulin resistance, which helps with weight loss. When fasting insulin especially, is elevated, you cannot lose weight. You just cannot. It's like blocking the release of free fatty acids in the weight loss process. Some people will gain weight more in the middle. So the insulin resistant patient will gain weight all over. When people gain weight in the middle, it's more of a cortisol issue. So I know when I see someone that's relatively thin but has a large abdomen, that person is probably under a lot of stress. So starting to talk to the person about what's driving that, to help them see, are there, even if we try to help their body feel that it's less stressful, if the situation doesn't change, sometimes will help. And then the third one can be like things like hypothyroidism, or like inflammatory conditions. I mean, people who get mold exposed often will gain weight, I think, as a compensatory kind of adaptation, that it's just because they're so inflamed. So their metabolism sort of is secondary to just survival. And so when you look at each person and kind of size up where they're gaining weight, how they're gaining weight, and how it came on, that's kind of step one to look at how could we potentially reverse that.
You talked about mold exposure, and I know we're going to have someone else on that's going to maybe go into it a little deeper, but is that common, mold exposure, and people having symptoms to that?
It's actually everywhere. It's just certain people are sensitive to it, which might explain why you might have a household of people who are all exposed and only one or two of them are having any health issues. And it's kind of, this is an interesting thing. Patients will get online and they will diagnose themselves, and then they will come to me and say, I have this or I have that. I find most patients it's more complicated and it's multifactorial, but I always include that in my potential problem list, because if you don't treat that, then a lot of the other things we treat also don't really get better.
That
so
is
it is
an
very
interesting
common.
take.
It's just not that everyone is sensitive to it. It's there's sort of predisposing factors to have a sensitivity to mold.
I think we're so busy. A lot of the time we kind of shoo off things that are going on with our bodies. Like, for instance, we wake up so early, so we always are like tired, dead tired, maybe at 2 o'clock. But what are some red flags that you listen for when you're talking to people? And those red flags would be like, okay, you should go to an integrative medicine physician. What are some of those things so that everyone in the audience knows?
Well, of course I'm biased, but I practiced regular medicine or allopathic traditional medicine before moving over to integrative medicine. And if someone just has maybe an intuition that they don't want to take prescription medicine for maybe whatever symptom they're having, an integrative doctor can look at them and give them a different approach. I spend a lot of time with my patients. Aren't like you guys. You guys are healthy and strong, and you're able to rebound even after you're sleep deprived. But over time, a lot of the patients I treat who have chronic complex illness are those overachiever, go-getter people who really expend a lot of energy and don't always adequately recover. I tell all my patients who I treat for chronic infections, probably they had the infection before and they just wore themselves down to a point where the infection had an opportunity to flourish, and then they become really ill and they have to rest to recover. So, if you start craving sugar all the time, if you start craving caffeine, if you need a nap every day, probably there's something going on that could warrant speaking with an integrative doctor to try to sort it out before it becomes more of a severe health issue. And the further that someone goes down the road of chronic complex illness, the more challenging it can be to try to reverse some of those symptoms, although we do try it and try to work with patients like that all the time.
Okay, doctor, if someone at home is listening and they think, okay, I want to go visit you, where do you practice? How can they find more information about you?
So I am actually the current president of ILADS, which is the International Lyme and Associated Diseases Society. And I mentioned them because we have a large number of practitioners all around the US and even in other countries who look for root cause or underlying cause in patients that have chronic illness. I'm located just outside of Austin, Texas, in Marble Falls, Texas. But it would be more meaningful, I think, for if someone is really looking for a doctor to look for underlying issues, if they went to ilads.org and went through the provider search option, they could find doctors or nurse practitioners or naturopaths or other clinical providers in their area and get a nice consultation where they could get more of an insight into what's going on with them.
Okay, thank you so much, Dr. Amy Offutt. We really appreciate your time, and we'll make sure to post that somewhere so that people can go and get some more information. But yeah, we really appreciate you.
Thank you for having me.
Okay. Yeah, interesting stuff. Okay, coming up, we're going to talk more about chronic illness, kind of take more of a deep dive with integrative medicine, because I think we can still touch on, maybe some vitamins that people should look out for, some more red flags that people should think of too from their day-to-day, and to see if this might be a good option for them. Absolutely. So we'll be right back after this break.
Welcome back to Chicago Now. So we're talking more about chronic illness, and things like Lyme disease can be debilitating for so many people, but not just that. There are people who have constant pain in their lives. So from autoimmune disease to Lyme, mold exposure, we touched on that with the last doctor. And something that I had never heard of before, it's called mast cell activation syndrome. Many patients spend years searching for answers, Gabby, and they just can't get to the root cause with their own doctor. So joining us now is Dr. Tanya Dempsey, an internationally recognized expert in chronic complex conditions. She's going to shed light on how integrative medicine can help patients find relief. Doctor, thanks so much for being here.
Thanks for having me.
So I think a lot of people have heard of Lyme disease, and of course so important in our area with those deer ticks. They've especially been very prevalent this year, and that can cause Lyme disease. But what about mast cell activation syndrome? What is that?
Mast cell activation syndrome is it's an inflammatory immune problem. So the way I like to think about it is mast cells are everywhere in the body. Everyone has them. They're really our front line of defense against the environment. So again, everyone will mount an attack if they're attacked by a virus, by some kind of infection, by some environmental toxin. These mast cells have sort of ammunition inside of them. They have these chemicals that they make. One of them that many people may have heard of is histamine. Mast cells actually make thousands of different chemicals, but when they see something that they see as foreign, and in some cases actually mast cells are also involved in allergies. They see pollen, they see mold, they see infection. They essentially explode. And they release these various chemicals, and they cause a first localized and then a more systemic inflammatory reaction in the body. When someone gets an allergic reaction, right, to pollen, let's say, or something they've eaten, right, they get swollen, they get itchy eyes, they get runny nose, they may have trouble breathing. So that can happen anywhere in the body, and sometimes it's not even an allergy, doesn't look like an allergy, won't be an allergy. These mast cells can act everywhere. They are found everywhere in the body where they're in communication with the environment. And so they're very important. But the problem is that in some people, the mast cells have become dysfunctional. They're not just reacting to the environment the way they should. They are in fact reacting as if they are they don't know what's going on. They're acting inappropriately. And so in people who have this chronic condition, mast cell activation syndrome, their body thinks everything is sort of poison to them. And they start to really react over time more and more. We know that there are infections like Lyme disease that can absolutely set off mast cell activation syndrome. We know that COVID, we know mold, we know lots of different things can cause mast cells to become more activated, and in some cases stay activated. And so these patients wind up with very, very complicated, complex conditions, really involving any part of their body.
Let me ask you this. Do you find that a lot of chronic illnesses, I mentioned this to the last doctor we spoke to, we're busy, things go dismissed, but do you find that a lot of chronic illnesses don't get diagnosed properly, that people kind of live their life maybe for years, for, a century without really knowing what's going on with their body?
Yeah. Unfortunately, by the time patients often come to me, they've been struggling for decades. Sometimes they have a stack of records from the Mayo Clinic, the Cleveland Clinic, every doctor that in their area, every doctor all over the world, and it's been many years, and no one has really spent the time to think about how these different symptoms are related to each other. Very often, these patients will have different symptoms that seem to be unrelated, right? This is the most common thing I see. They have headaches, but they also have stomach pains. They have knee pain, joint pains, muscle pains. They have brain fog. They have depression. They have, these various symptoms. And so what winds up happening is they go to the headache doctor, the neurologist for their headaches. They go to the GI doctor for their stomach pain. They go to either an orthopedist or a rheumatologist for their knee pain. And they're basically, this is what modern medicine is about. It's, you have a problem, you go to the specialist who can take care of that particular problem. But no one has really taken the time, which is what I do, to really try to fit the pieces together into the puzzle. There's a puzzle, and all the pieces will fit in somehow, but no one has taken the time to understand that the headaches and the stomach pain and the knee pain and the muscle pains and all these things are actually rooted in maybe one or two, at most usually, conditions that are causing this inflammatory. This is all inflammation. Causing an inflammatory reaction, and more we are seeing mast cell activation syndrome actually as the root cause of these symptoms. There's something that triggered it, and the triggers are important to talk about, but ultimately the symptomatology, the things that the patients are dealing with, are because there's an inflammatory reaction in their body, and it's setting up shop in their brain, or it's setting up shop in their knees, or it's setting up shop in their GI tract. But again, people are then, specialists are honing in to that one symptom and not understanding that there's a bigger problem.
What is the solution oftentimes? Is it diet? I would think it would be, or maybe something in their home. I mean, what do you find?
Yeah. So what I do is I go through, I get a very thorough history, and then we start to go through potential triggers. So the triggers could be things that they're putting inside their body. Something to one person that may be perfectly fine may not be good for another person, right? There may be a food or a class of foods or something like that could certainly act as the trigger. It could be, too much sugar. It could be dyes in actually even in some pills that they're taking. Lots of pills on the market have all these blue dyes, red dyes, etc. Maybe they're being exposed to something that way. So there's something internal going into them that we have to look at. We also have to understand the environment that they live in, and more we are seeing a really incredible problem with mold exposure. It has to do with the building materials that are used. It has to do with whether the home has been remediated after a flood or a leak or water intrusion into the home. And so lots of times what happens is patients don't even realize they're being exposed to something. They're breathing it in, and it's making them sick. We start to do some testing. We start to suggest they move out of the area they're in, even for a brief period of time, to get some information to try to figure out, again, what is the trigger. Triggers could be things like, believe it or not, things like breast implants, things that went into the body that the body is now recognizing as foreign and bad for it. It could be things like stress. I really have to mention some of the easy things. It's not so easy, obviously, but things that we maybe don't think about as often. But increased stress, not enough sleep, there are all these factors, and it's important that we go through all of it and try to hone in on the ones that are really affecting the patient the most.
You know, maybe this is a silly question for you, but is there testing that you recommend for people to test their home if they, have mold around? I mean, it seems like it's invisible, right? How would you know if you have it?
Well, that's the thing, and there's actually a little bit of a misunderstanding about mold. A lot of people think that you have to see black mold, and black mold is the problem, and nothing else is really a problem. And mold can be different colors. It could be white, could be green, could be black, and they're all bad. And they can often be colorless. They can be in the HVAC system and not visible. And so there are testing systems. There are home tests that they can do on their own. I have some of that on my website that they can look at. There are very qualified, certified mold inspectors, essentially, that can come to the home and take a look and inspect the home and see if there are areas that could probably be problematic, based on maybe they see some evidence of some water intrusion or something like that. But so there are sort of like DIY ways to sort of figure it out first, try to get some understanding of it. We also have testing that we can do on the patient to see if they've had mold exposure as well. So we put the two pieces of information together.
This information is so valuable, and I'm wondering, a lot of times certain treatments are cost prohibitive for people. Excuse me.
It's true.
Are your services covered by insurance?
Unfortunately not. And the reality is that I spend 3, 4, 5 hours sometimes with a new patient. I spend hours with follow-up patients, sometimes especially if they're in the midst of a major flare. The insurance model really, sort of recognizes a 10 or 15 minute visit at most, maybe 20 minutes for a new patient. I really admire doctors who are still working in the system because we need them for sure, and they're important, but insurance does not recognize, unfortunately, the type of work that we do and the amount of time we spend. Having said that, we really do our best to try to get some of the testing, a lot of the testing, and a lot of the other things that we do here covered by insurance. We'll use a lab that is recognized by and accepted by their insurance, like Quest or LabCorp or whatever. We try to get as much as we do here covered by insurance, even though the visit itself isn't covered.
Okay, well, thank you for being transparent with that. Now, we could talk to you for hours. We're running out of time, but I do have a question for you, because we always love free medical advice around here.
Who doesn't?
We love free legal advice.
Since
we love
we've got
free medical advice. So we have a director that's behind the scenes, and I remember him saying that he has chronic pain. I think it was chronic Lyme, and then now he's dealing with fibromyalgia. What is some advice? I know that's blanket. You haven't seen him, you haven't talked to him, but what can he do? Because I know there's probably people at home who are dealing with something kind of similar.
So, the first thing is really to find somebody who can really get the right history, to dig deep, to figure out the root causes. Like Dr. Offutt mentioned earlier, I'm on the board of ILADS, the International Lyme and Associated Disease Society, and we do have a network of physicians and medical practitioners all over the world, essentially, who know how to dig deep. Things that he can start to think about on his own, or, looking at the diet and seeing if there are inflammatory foods that he's eating. Fibromyalgia is a little bit of a buzzword for mast cell activation syndrome. Again, I'm not going to diagnose him, but I'm going to say that it may be worth seeing somebody who has some experience with this condition, MCAS, to see if maybe that is at the root. Maybe the Lyme is chronic. Maybe there are other infections, they're called co-infections, that are associated. There are infections called Bartonella, Babesia, and lots of others that can cause pain. So he might really benefit from seeing somebody who's been trained the way we've been trained, to think about all these possibilities, because I will say there's a lot of hope. I want to leave everyone with this message that we have a lot of answers now, more and more in terms of the types of testing we can do, more on these types of illnesses. And so there is hope, because knowledge is power. So once you know what's going on, there are treatment options that he maybe doesn't even, know about. So that's what I think, let's leave with that note that that there's a lot of hope for.
I like that ending note. Thank you very much, Doctor. We appreciate your time. Dr. Tanya Dempsey, internal and integrative medicine physician. We appreciate you. Thank you for the advice. We'll have you back on again, that's for sure.
Thank you.
Thank you.
Okay, have a good day.
Take care.
All right, coming up, we're going to switch gears just a little bit. We're going to talk about wellness with a wellness influencer.
I'm excited about this one.
Tricks.
All right, I want to look like J-Lo, okay? So make sure you
I think
get the prescription.
That over on in the green room here that we have. Okay, Nat, we'll be right back after this break. Welcome back to Chicago Now. Okay, we've been talking about living a healthier lifestyle. And right now we have with us a wellness influencer who is Chicago-based, Lauren Les. Thank you so much for joining us.
Yeah, thanks so much.
We appreciate it. Okay, Lauren, what first inspired you to step into wellness space and share your journey with others?
Yeah, so I have a lot of chronic health issues that I developed several years ago, and then I suddenly developed food allergies too. So that kind of inspired me to start my page and start sharing about my journey.
Interesting. Can I ask what kind of things you're dealing with?
Yeah, so I've been diagnosed with mast cell activation syndrome, a connective tissue disorder, POTS, Lyme disease, and I've had mold exposures that kind of set off all of those issues, and then suddenly developed all these IgE food allergies, the type where you have to carry an EpiPen. So that just randomly happened when I was 25. So.
Interesting.
It's someone so young. I was going to say, it really seems like you have been down different paths and learned a lot.
Yes.
Yeah.
Yeah, because we were just getting done talking to a couple doctors about some of the things that you just mentioned. So it's good to see that now we, have a face to it kind of, and have some tips and tricks for people at home who might be dealing with some of the same symptoms as you are. So from supplements to diets to exercise plans, how do you cut through the noise, the weeds of what really works?
Yeah. I think for me, it's most important for me to really listen to my body, and I've honestly found that the lifestyle pillars like sleep and diet and things like stress have been the most important for me, and movement. There's a lot of noise on social media. You can find conflicting opinions. Someone will say eat only meat, and then someone will say only fruit, only veggies, and I've just found that a balanced approach has been the best for me.
Can I ask you, has there been anything on social media that you found you're like, oh, maybe this is really going to work for me? You try it and it hasn't really worked for you? I know that's a very particular question, but do you have one in mind?
I'm trying to think. I think a lot of the diet noise, I'll try different diets and things like that, and maybe they won't work for me, or specific exercises that don't necessarily work for me because my body, I have a connective tissue disorder, so I have to do more gentle, low impact things. So you'll find somebody being do HIIT all the time,
right?
And that's great for you, but that might not be good for me. So that's why it's so individual.
So you brought in some things here, and I assume this is going to go along with the next question.
Yeah.
So back to school or fall wellness tips. What do you have for us?
Yeah, I actually just did a back to school swaps thing. So I think, there's better options for lunch boxes, using stainless steel instead of plastic, or stainless steel water bottles instead of plastic. There's lots of healthier foods that you can put in lunch boxes. Cleaning supplies.
What? Because I'm a mom and I'm always looking for ideas. So what would you recommend?
Yeah, I mean, I'm not a mom, but a lot of the things I eat too. So there's better fruit snacks solely that have 2 ingredients versus several ingredients with artificial flavors and colors. Yum Earth makes a lot of different candy. And then, fruits, vegetables, focusing on things like that, obviously. There's different nut butters that have simpler ingredients that don't have sugar. Some of those are things to look at.
Do you find that you're really, letting your audience know that ingredients are important? Because you probably found that in your journey that you really need to look at the label.
Yes, for sure. And so because I got diagnosed with food allergies, that's what made me start really looking at the labels and starting to read things, because before I just would pick up a food and eat it, and I never had to look at the label.
Okay, so dive into what else you brought in here.
Yeah, so I brought, this is like a non-toxic candle that uses beeswax and essential oils.
Okay. Let Gabby smell it. She wants to smell it.
Yeah, smell it.
I will smell it.
It smells good.
Let's see. Oh my gosh, so good.
Yeah.
Oh, cinnamon,
It's not
orange
too
clove.
cinnamon. It's not too too orange.
Sometimes I get headaches from candles.
But
so
this
I
is
like that
something.
one.
Yeah, and that's what happens a lot because there's like chemicals being released into the air. So this one's like a better
And
swap.
what brand is that one?
This is Fontana.
Okay.
Yeah.
And so, even going in a grocery store and stuff like that, being in that candle aisle or in Target, you get overwhelmed by the smells.
Yeah.
Could that trigger, someone with an autoimmune disease or someone like you to be maybe there for too long?
Yeah, I mean, I kind of avoid like those aisles and the cleaning supplies because I just get like dizzy. Like, I'm very sensitive, so I notice that I have symptoms if somebody has a candle lit in their house, or if I go down a cleaning aisle, or like even just being out and like somebody just cleaned, the chemicals bother me. And that's what I think people who are sensitive start to realize.
Okay, what else did you bring in?
This is like a less toxic cleaner. They have like a whole set where you just like fill up the bottles. And then this is a swap, basically like a glass instead of plastic swap.
Is that for like a lunch or something?
Yeah.
Okay.
It's really cute actually.
I like that because you know what? The ones that I have are like the big heavy. Let me see how heavy that is. Oh yeah, this isn't bad at all. The big, the square ones,
Yes, the ones from
lids fit all
Costco and
wonky and stuff.
yeah.
And I love this because the lid screws on.
And it's cute.
Can you microwave this?
I think so, yeah.
Okay, well that's fantastic.
And this is another kitchen swap that you could do.
Yes, so this is like a wood cutting board instead of plastic. There's been a lot of like talk about microplastics lately, so I wanted to touch on that. So like glass instead of plastic. Wood instead of plastic, because then when you're like chopping food, you can get like the
I have a lot of
microplastics
problems in my house. My goodness, I need to make a lot of changes.
Well, and
I could be a new woman, Gabby.
You could be, Nat. And we have a laundry refill wash. Wow, you really brought a lot of examples in. Thank you. But this is something, I mean, you're wearing your clothes, so yes.
They're touching your skin, and I actually was like getting hives from using like regular detergent that had a bunch of chemicals in it. So this one's really good because it smells really good and really strong. So I think it's an easy swap for people to make because a lot of people like that like strong, good smell.
Yeah.
I'm gonna prop it up here. Okay.
Yeah, so that's a good one too.
All right, and then the pans are because you don't want the nonstick stuff
Teflon.
coming off, right?
Yeah.
And eating that, ingesting that.
Yeah,
Honestly, with all these examples, yes, they're different than what we're seeing in the stores, like, right in front of our face, but it doesn't seem like they'd be that expensive of swaps that you could make, right?
For sure. I mean, I just did like a whole budget-friendly series too. Like, there's tons of things that you can grab on Amazon or wherever that are just like better swaps that aren't super expensive, like the best top of the line.
Where can you
swaps.
find that information?
So I have like a bunch of information on my Substack. I do a series every Sunday where I send out swaps. So I do different categories.
Okay, for people at home who are interested in learning more advice from you, because even if you don't have a chronic illness, you're not dealing with all these symptoms, you can still make these healthy swaps just to live a healthier lifestyle. Where can they follow you?
At Less with Lore on Instagram or TikTok.
Okay, and is it a lot of swaps, or what other content are you producing?
I do a lot of recipes too, and just like wellness, because I had to change my entire diet, so I had to go gluten-free, dairy-free, and I have several other allergies too. So that's really how I started, is with the recipes. And then I just share like wellness tips and things that I'm doing to help with my overall health.
I'll check it out. Thank you so much, Lauren.
Lauren Less, thank you very much. Chicago-based, a wellness voice here, a wellness influencer. We appreciate your time. We appreciate you bringing everything in, and we'll be right back.
Thank you.
We only have a little bit of time left here in the last hour of Chicago Now, but a really interesting show. We're talking about living a healthier life. We talked to a lot of integrative medicine physicians, giving some advice with that. Also, the wellness influencer that we just spoke to. I would say this is a pretty successful show.
I would say I'm poisoning myself is what I've found. And I'm lucky to be alive at this point.
It is scary, but I do like how, especially Lauren, who we just got done talking to, she made it pretty easy to know some easy swaps to do in your household. So hopefully you learn more while you watch us continually. We'll see you tomorrow.
Have a great day, everybody. Bye.